When we talk about AI and artificial intelligence, we utilize AI in some of our patient engagement software as well. But people don't understand it's built.
Instead of searching on Google, very likely you're not going to get an answer from Google. Even if you're new to this, you don't know where to go. You cannot just ask ChatGPT because it's not going to give you the answer or the correct answer.
AI is here, but a lot of times they're general. They have to be trained to do things effectively. But imagine putting all information about risk adjustment and how it affects you as a provider is basically put in the palm of your hands. Are you a struggling medical practice owner and looking to understand medical billing more effectively? Well, I have a great guest today. We're going to go into medical billing, medical coding, and more specifically risk adjustment and how it affects you as a medical practice owner. I'm here today with Prince Baawuah. He is the founder, CEO, and chief tutor for the Hills Academy. Hills Academy is really focused on helping and creating innovative technology solutions and helping to break down mundane, complicated claims, encounters, and risk adjustment and data adjustments and resources and make it easy, simple, and understandable for just about anyone. So Prince, thank you for joining today. Love to get into it.
Thank you so much, Theo. Thanks for having me. And I'm excited to have this time with you.
Absolutely, absolutely. So let's get right into it. What is risk adjustment, right? I have an audience of medical practice owners, providers, doctors, nurses. That is something they may not be familiar with. So can you break that down high level? What does that mean for them as medical practice providers?
Yeah, thank you so much. Basically, at a very high level way, risk adjustment is a method, it's a mathematical method. So it uses math and science and the mathematical and the statistics, but don't be focused on that one. It's a way that providers and health plans are paid fairly, right? It is about fair payment and using statistical methods. The risk adjustment process makes sure that a provider that is taking care of a sicker patient get paid equivalently than a provider that is taking care of a less sicker patient or a provider that is taking care of the most sickest patient. From a health plan or for a provider, risk adjustments is a methodology in the context of Medicare Advantage space where the CMS makes payment to the health plans in a very fair way so that they have the necessary resources to take care of the beneficiaries that are enrolled in the plan and also by the provider that is there. So at a very high level, risk adjustment is about fair payment to get the resources you need to take care of the Medicare beneficiaries that are enrolled in your plan or you're taking care of.
Awesome. So if I'm a provider, if a medical practice owner, so I'm doing my billing, understanding what diagnosis codes are required, let's say the patient has end-stage renal failure or diabetes or hypertension. And so we have diagnosis codes based on ICD-10. We classify and put them all together. Now, does all that information get sent into another type of coding system? I think it's called like HCC. How does that break down?
Break that down.
Yeah, how does that break that down? Because from our standpoint, when I talk to them on the billing side, they get the diagnosis out and they get it to the clearinghouse, right? And then they wait until things get approved or if it doesn't get approved. So how does that get into the insurer, the Medicare Advantage plan? And so how do they kind of look at it to determine, what is the reimbursement? Because obviously as an insurer, they're looking to work with the government, especially with Medicare Advantage, to determine what that fee is going to be, how much the government is going to compensate the insurer for the patient and the services that were done for that patient.
Like with the HCCs, as I said earlier, the risk adjustment is a mathematical methodology, right? So there are several versions of the methodology that one can use, but for the Medicare Advantage space, the methodology that is being used is the HCCs. Right. And so the HCCs, ICD diagnoses are a lot of them. So the HCC, which is the hierarchical condition categories, that's what HCC stand for, is a way that the mathematical process pull the diagnosis together, make sure, put them in hierarchies so that the government can make the right payment. Do the fair payment process. So at a very high level, HCCs are one method. There are several risk adjustment methodologies out there, but for Medicare Advantage specifically, when a provider or a coder put things together, put the diagnosis together, goes to a clearinghouse, the clearinghouse to the plan, the health plan depending on what kind of arrangement between the provider and the health plan. If they are submitting claims, then the health plan process adjudicate the claim and send it back to the provider, pays the provider. But then the health plan now takes that data data, claims data, and create an encounter data record. That is what CMS wants. So they transform the claims data into an encounter data record, and then they submit that to CMS with all the diagnoses in. So the health plan is submitting everything to CMS. And now when CMS gets that encounter data record, now CMS can now take that and filter, which is the process that is being called. It's called the filtering process. So CMS have some rules and to really extract all the necessary information that are needed for the risk adjustment process. And that CMS use that, take the diagnosis, convert that diagnosis to HCCs. And now with the HCCs, each of the HCCs had a coefficient. Just think of it as your math class. They come with a coefficient. So a diagnosis that triggers a higher coefficient, or a diagnosis that triggers a coefficient that has a higher coefficient, that means the patient is very sick and they're all relatively sicker.
Just to break it down. So for example, if a patient, have cancer, obviously their risk adjustment factor will be higher than say a patient with just hypertension. In some cases, like you'll be surprised, obesity has a high coefficient in certain cases. And so I think that's something that helps to understand that a lot of times these risk adjustment factors are weighting things a little bit higher than you may not know, right? Because of different cost factors that associate with taking care of those sicker patients. Because as we know, obesity has a lot of other comorbidities that attach to that. The scientists and research, they just know that these patients who are a little bit overweight or morbidly overweight, they will probably have a higher risk adjustment factor. So they need to get compensated more to take care of those patients.
Yes, definitely. And as you said, it's beyond the one diagnosis, right? It's a multiplicity of diagnoses, and that's being ranked. And then there are some also demographic factors like age and sex, and sometimes Medicaid status and ESRD. So there is a combination of things, but at least the mathematical model is put together so that it can predict how one is likely to use service based on all the comorbidities and all the other things, factors put together. Or the health plans, at least for the Medicare Advantage area, are compensated fairly for the risk that they are taking on, which ultimately pass on to the providers.
That makes perfect sense. So obviously this is the whole process, you got the two sides to kind of understand all this. When you kind of look higher level, what does this mean for like providers? Why should they care about that side of the business? Obviously they bill what they bill and they send it in to the insurer, goes to the clearinghouse, and then, they just wait to get compensated. I know for a fact there was a recent Change Healthcare hack. And so a lot of Change Healthcare does clearinghouses for thousands, almost, hundreds of thousands of doctors and hospitals across the country. Because there was a hack, the whole system shut down. And so there were a lot of independent practices that weren't getting compensated for months, right? Until the system got back up. They had to go back to pen and paper, right? To submit claims again. And that was a struggle. And I think that opened their eyes to like, wait a minute, we need to get more awareness of how our medical billing process works. If you look at this other side of the business, when you're the insurer that's, submitting it to get compensated, so then the provider can get compensated. Why is it important for a provider to understand all of that? We understand now they need to understand clearinghouses better, understand who's submitting their claims, right? To the insurer. So that's one side of it. Now, why is it important for them to understand what the insurer is submitting to the government? Why is that important for providers at that level?
I think one of the things that I've seen that providers, it's best for them to understand is that providers' medical record, based on the risk adjustment policies, the medical record is the source of truth. So health insurers do not own or do not have the medical records. It comes from the providers. And therefore, the health insurers are dependent on the providers to get that information that the providers may send it in as a claim record, or if depending on the arrangement the health plan has with the provider, that the health plan is holding on to the provider to get data, then they process that together and send it to CMS. Guess what? The risk adjustment process is also time bound, right? So the time bound meaning that there is a deadline for each of the payment years, throwing out terms here. But in terms of 2024 or 2025, there is a deadline to it that all the data has to come in that counts towards a payment. So for example, using this Change Healthcare process, if you are aware of that process, then you can work with the health plan to make sure you get all the data to the health plan do its thing, and then pass it on to CMS, and therefore get back to the health plan and health plan back to the provider. But if you don't have any understanding of this, or you think it's not important, or you are not even aware of that, then you may be submitting data at the wrong time And then when the health plan now has it and now change it from a claim to an encounter, it's going to take another time to another clearinghouse. And by the time the health plan submits to CMS, the time has passed. If the time has passed or the deadline has passed, guess what? Then the health plan doesn't have that money. Therefore, the health plan may not have the money to pass that back on. So you don't have to understand all the details. You just have to understand or be aware of some of the high level things so that you can be a partner to your health plan and also ultimately to CMS, because you are taking care of the patients. Another area that of importance that I want to stress here is just imagine as a provider, the data that you submit to the health plan is erroneous and the health plan passes on to CMS. When CMS is doing audits, for example, the GAO, the Government Accountability Office, and there are so many reports that are out there. If GAO is making the audits or even CMS is doing the risk adjustment data validation process, you know where they go for data? As the provider's office. So the health plan is more of a pass-through, if I may put it in that terms, but as a provider, if data is erroneous and CMS is doing audit or OIG or GAO is doing audit and they come to you, they have immediately disrupted your process, your practice, your patient. You already don't have time. Just imagine all these audits are going on. So as a provider, if you're a partner with your health plan, you are able to submit data to them and they can pass it on. And guess what? A health plan also passes some CMS reports to you. You are also become a partner to know how best you can support the health plan so that the health plan can better support you. So I think providers' understanding of this process or awareness of this or the revenue cycle awareness of this is very crucial so that you are partners to making sure this process work for you, work for your plan, and work for the patients that you are taking care of.
No, I think that's spot on, right? We do remote patient monitoring, chronic care management. And how many times will we submit billing and then comes to find out they need medical records, right, to validate, what was done, when the data service was completed and all that. So the insurer health plan is reaching back out to us to kind of validate all this stuff because they have to get it through their processes, right? So I've definitely seen that constantly and because they'll just immediately just to deny stuff, right? Because in their mind, they won't even pass it on without making sure they kind of dot the I's and cross the T's. But to your point, I did talk about this in one of my videos about OIG Audits. I had a chance to go to RISE Health Conference, which is one of the largest conferences centered for Medicare Advantage health plans. And they talked about that. They're looking at the data set around what are areas of concerns, right? And telehealth, we just went through worldwide pandemic and, telehealth laws were a lot looser, right, during the 2020s and 2021. But now that public health emergency is over, we're going back to the old rules, and a lot of providers may not be aware that they're billing things incorrectly now. And OIG is looking at that. And to your point, they're doing a lot of data analysis, but then they'll determine, are they upcoding, basically providing services that they didn't really render to the patient accurately? They're going to look at this data and they're going to pinpoint providers, to your point, that they want to target, and they're going to use the health plans and insurers to kind of help with that, right, process. So to your point, you want to avoid that risk piece of it. But I do want to talk about this. Healthcare is about protecting patients and making sure they're safe. The risk part of it is that we have to make sure we're following all the rules. On my side, I have to sign business associate agreements and making sure we adhere to HIPAA laws. And likewise, submitting these billing, you have to be accurate with your billing. Understand that process just makes more sense in my opinion. So when you kind of look at, I want to double click on the time bound aspect of it, right? So from my understanding from insurer, just to help the audience understand this, there's kind of like two timelines, right? There's the health plan design process. I guess that happens certain times of the year. And then there's this risk adjustment process. So can you kind of walk through what are the two time periods that health plans are basically, changing up health plans so that you can be aware of as a provider that I can bill for this, or I can do these different programs. And then what's the other time bound when it's risk adjustment, where they're kind of looking at what will be accepted or not, and potentially you maybe come back and say, hey, we're going to recoup this payment or we're going to do something else, provider. Do you have a sense of those timelines and how does that affect maybe a provider at that level?
Yeah, at the higher level, my expertise is not in the bid process, and I think that was where you were referring to, the bid process, where the health plans are now developing new benefit packages and pulling things together to submit to CMS, but they also depend on many of this risk adjustment data in that timeline. But I can talk much more on the risk adjustment timeline. So on the risk adjustment timeline, risk adjustment from the Medicare Advantage perspective is prospective payment, meaning that the plans are getting paid ahead of time. For example, we are in 2024 right now. So every month the plan is getting payment for every month. So we are in May, so you get May payment ahead of time. June, you get June payment. Even if you're the beneficiary use service or not, the plan gets paid because of the risk adjustment process. But the CMS does three ways of calculating payment. There's the initial, there's the mid-year, and then they do final reconciliation. So what CMS is doing is paying you ahead of time with data that is behind or prior data. And then once all the data comes in, CMS will go back and reconcile all of them. Once CMS has all the data, CMS goes back and reconcile. And if there are any credits and debits that CMS have to do from the payments that they made, they can go and recoup them or pay you more. Nonetheless, after the deadline hits, so for example, usually the deadlines are in January 31st or February 1st of that year. So we are in 2024. So this year, I think it was payment year 2023 that just ended. But in 2023 payment, you are using 2022 date of service. It's a very weird looking at things from a 3 year. You have to be thinking from 2022 date of service. 2022 date of service ended, or services were done in 2022. So as a health plan, once the deadline hits, or a provider, once the deadline hits, and then CMS is going back and doing overpayment runs, which means that CMS is going back and looking at this data and saying, a health plan, if you know you have been paid more than what you had submitted in, you need to clean this thing up. And you have about I think it's a 6-year look back period. I can double check, a 6 or 7 year look back period, but you have that time for you to clean up. You submit or delete. So as a health plan, guess where the health plan is getting data to clean up? Very likely going to the provider. Going to the provider. Or even on several reports that they came, that CMS sent to them, they are now looking back and reviewing and coming back and making sure to clean them up because they don't want to get into any audit problem or audit risk. So those are the timelines. The health plans are submitting data to CMS. CMS is using that data to calculate payment ahead of time, and then CMS now go back and look at it, and it goes through that process and clean up for that time. So as a provider, you may have thought 2022 is done, we're in 2024. Why do I still need 2022 data? Because of that, because these risk adjustment processes are looking back with data and reconciling that from that perspective.
So if I can net it out from our audience and how we think through it. So basically we're doing remote patient monitoring or chronic care management or these kind of virtual care kind of programs, and we're billing them out, like you said, submitting it to insurer, the plan, the health plan, they get into CMS. CMS is paying right away, and then they're passing that down to the provider. So basically, this is 2024. So all this will be looked at by the end of January 31st or February 1st, 2025. Is that correct?
2025. Yeah, that is.
And then that's the deadline to kind of collect, making sure, okay, this is what we sent out. Let's say is, $50 million or whatever for just CCM, RPM services. So now we have to close the books by January 31st, February 1st. And then now we have to go in and then CMS will let us know if that was accurate or not based on their data sets and all that. And then we have to make sure that we recoup that money back from the providers, right? We say, hey, you know what? We may have overpaid here because CMS is asking us that this was inaccurate or something like that. Is that how that typically works? So 2025 would be a period of time where they're kind of looking at everything. In 2024, determine what's going to get paid out and what adjustments need to be made. And then they'll let the providers know by the end of 2025? Is that typically how it works?
The timeline, I will have to double check mostly on how the dates, because it gets very confusing. And that is where most of the work that I'm doing on the Hills Academy, how do I make it clear in that way? Yeah. But basically, if we're looking at 2025 payment, you're using 2024 date of service data, right? 2025, you're using 2024. But 2024 will not end in terms of when the plans have data to submit to CMS until like 2026. Because the plans have a year and a month after the year finishes. So as a plan, as a provider, you may have thought like, we finished 2022 or 2024. Why are you still, I closed my books for 2020. Why are you still looking at this? But because that is the data that the plans need to submit to CMS, that CMS uses to calculate. Gotcha. To not get so much into the details, like the initial and the mid-year and the final all have different dates of service cutoffs that you have to be very careful of, because just imagine, if CMS does the initial and the initial get paid from January to June. So if you don't have the right data in there between that deadline for the initial, and that is what CMS is using to calculate for 6 months, guess what? All your 6 months data are all underpaid.
Yeah.
Right. Just imagine
Gotcha.
you are working and you needed to wait till final reconciliation, which is a year past to get all the
Mhm.
true money. So you will have to understand this, submit the right data to your health plan, the health plan pass it on to CMS so that your health plan has resources to pass back out to you. Because immediately the health plan is crunched, but the patient is still using service, right? The
Yeah.
patient is still utilizing service. So even if you're underpaid for 6 months, the patient is still using service. As a provider, you are really crunched. So you want to submit the right data at the right time so that you get the right payment so that you're able to take care of the patient in the right way. And that is what the Heals Academy making it simple. Because even talking through it, you see the complication that comes in. But Heals Academy is set up to make it simple, easy for provider, for your team to have one place to go that you know that you have quality resource, easy to use and understand in order to execute in this way.
No, that makes perfect sense. So let's double click on that. We kind of understand the importance of why providers at that level need to understand it. So how are you at the Hills Academy kind of looking at this and maybe using technology to help train people around risk adjustment to understand it better so they can utilize it more? You really be prepared for incidents like this that may come up. How are you kind of thinking through that at the Hills Academy
So
and helping others?
yeah, so Heals Academy is about making these resources useful and usable. And I always like to put this in a quadrant that if something is not useful and usable, it will not be used. Therefore, it is useless. But if it's useful and usable, then it will be used to make impact. So Heals Academy we are creating resources. So several of them. One is our YouTube videos. You can look at the YouTube videos. It's easily accessible. Digging through some of these terminologies and resources one at a time. They are very 5 minute, quick to look at. The second thing that we are very excited about is the Risk Adjustment Success GPT. And the Risk Adjustment Success GPT is made to make sure, just like your Chat GPT, that have done a lot of the legwork based on my experience working at CMS previously. Take many of these resources, clean them up, curated them, standardize the languages so that if you're looking at one resource and it's saying calendar year and another one is saying payment year, and you're new to this, you're like, are they the same? Yeah, Heals Academy has taken care of that for you. So clean them up, put them together, and has added on a large language model that users can easily ask questions. For example, we're talking about payment year. So you can ask, what is the deadline for payment year 2024? And then it will go through the resources, clean them up, and quickly return a response to tell you the deadline for payment year 2024. Instead of searching on Google, very likely you're not going to get an answer from Google. You may go to CSSC website, or even if you're new to this, you don't know where to go. You cannot just ask ChatGPT because it's not going to give you the answer or the correct answer. But that is what Heals Academy does. How do we create simple, usable, and useful resources for audience, either providers, either for health plan, either your billing team, so that it's like a pocket advisor. You can pick it up, you can ask the question on your phone. You may be in your child's graduation and the deadline is looming and the provider or the health plan is saying, we need this data very soon, or a question comes in. You don't have time to go open your laptop, trying to search online and all these things. Pick up your phone, open the Heals Academy app and just ask the question, and it's going to give you the response. And as we are going, we'll be adding in the various references, and we are going through various references so that you are able to give the references of where you got your information from, easily usable and useful. Take and give you your time back. That is what we want, and we want everybody to be masters in this space as well.
Yeah, think about it. Artificial intelligence, AI is here, but a lot of times they're general, right? They have to be trained to do things effectively. But imagine putting all information about risk adjustment and how it affects you as a provider is basically put in the palm of your hands. And so that's really what this is about. When we talk about AI and artificial intelligence, we utilize AI in some of our patient engagement software as well. But people don't understand it's built on our data sets, which is over decade of understanding patients and how they communicate with them. You can't just go to a general bot or Google to find this information. This is built on your knowledge. I'm sure decades in the making, right, to understand this stuff and understand it clearly so you can use it and be informed. And so I think that's what people have to understand. And I think you may be giving us a link to it. So if you're looking down the description, we'll have a link to go try it out and be on the wait list. But this is something that we think is going to be extremely helpful for providers, anyone just interested in this space, because there's an opportunity if you're looking to grow in understanding risk adjustment. This is definitely a growing area in healthcare. And so this is something you're interested in, whether you're a medical biller now or just a provider that wants to understand this better, go ahead and try out this tool and use technology to your benefit. And so I think that's
the crazy thing about this that I love is that as I'm working on this, I put it in with the general intelligence AGI. As a provider, just imagine like someone asking me to explain risk adjustment to them as a coder. Then I may need somebody from a consultant or a provider. The benefit on the cool thing about this that I really love is you can tell it, I am a provider. I have no experience in this. Use an analogy to explain this to me. So based on the knowledge, it tailors it to you, and then it gives you the information, even with an analogy. And I just love that, because just imagine sometimes you may not have the same person. I may not better explain things to a nurse versus coding specialist or a provider, but with this tool, it just democratizes that ability for the AI to explain this same concept in different area based on the preference. And I really love it whenever I'm using it for my own use cases. So I'm very excited. I'm very excited about it.
Yeah, and let's just talk about technology in broader sense, how innovation can be brought to healthcare, right? I think this is something that telehealth was going to be this big thing to kind of change healthcare. We are seeing some pullback a little bit. I don't know if you saw some recent news about big organizations. I think Walmart and other folks were kind of getting out of primary care, and then I forgot what big company was getting out of telehealth as well. And so, it's this pull and push, right? We thought it's going to be this great innovation that was coming in, helping for accessibility and using technology like telehealth tools. But I am optimistic. I think both you and I are technologists, are the core of our programs. One is in education and ours is more patient engagement, is technology. And our thoughts are that, technology is just a useful tool to make the individuals just more superhuman. Technology or AI will never ultimately replace us, because healthcare is so personal, right? It's one-on-one. We have to connect. But having technology with the human just makes them a superhuman, right? So they, like you said, if you can explain, risk adjustment to someone as if I was a fifth grader. And so when I go talk to my insurer, I can explain to them exactly what's going on so they can get it through faster. That's really what this is about, right? To help you do your job more efficiently and faster. And I think technology can do that. We've seen it work well for us as well in being able to kind of communicate things at scale and make it more individualized, right? So if we're able to communicate to patients who have not done their readings or blood pressure readings, or reach out to the nurse, we can customize it to the patient name and just say, hey, how's you going, Miss Johnson? We saw you missed the last 2 days, is there anything we can do to help? And so it just helps to kind of personalize that for that potential patient. And then the nurse will come in afterwards and see the response and then reply back with the human response. And so I think technology is going to be huge in healthcare. And I think people have to realize to embrace it, not run away from it, right? There's talk about diagnoses and all that. I think that's coming. I do think there's some use cases for like radiology, but I think it's still early stages for deep dive diagnosis. But eventually we'll get there. So I'm super excited about that. One last thing I do want to talk about, just health equity. That's a big, core to our heart. I think we, around 50% of our patients, disproportionately, Black and brown populations, and, having access to doctors with our tools and technology helps them feel more connected. What are you seeing? How can technology or the Hills Academy in general, how are you kind of targeting how to help, when it comes to health equity, underrepresented patients and populations?
One of the things that inspired me, and I did my dissertation work on telehealth, and it's funny that you are talking about, and my dissertation was on telehealth during COVID in Medicare beneficiaries. And I was driven by health equity. So using the social determinants of health variables and things like that to work on that. But definitely, one thing that I'll preface this, when I was growing up, now that I'm old, but I wanted to be a physician, right? But I have come to understand just the business side of healthcare, with my training in public health and health management and policy. Just imagine a provider that is serving underserved communities. They're already short of resources. Risk adjustment is about fairness, right? Fair resources to take care of beneficiaries. Just imagine the provider do not have the necessary resources. Why? Because they may probably not have coders, or they have coders who do not understand the entire system and how things work, or they may not have the data team that is going through resources, and then they are already burdened. if they don't have the necessary risk adjustment resources and understanding, give the provider a couple of years, they will go down. The practice is gonna get closed. The community that they're already taking care of is now they're gonna be even much more underserved. But just imagine they have a tool like the Risk Adjustment Success GPT, or they have some of the resources that we are developing to make sure that they have the time to save time and save energy in understanding these. They understand how to work with their health plan. They understand how the data goes in and out. When CMS submits reports to the health plan and the health plan passes to the provider, they understand it. They know how to navigate through it. What do you think the impact will be? Like, this will be a flourishing in practice, that they can now have time, they can now have the necessary fair resources. And some of the things the HEALS Academy, we say we understand the risk adjustment facts, which is fair, accurate, complete, and timely payments. That is our goal. You are getting the knowledge, the understanding, and even much more the processes to make sure you understand the processes, get things in that you get fair, you get your accurate, complete, and timely. So as a provider, just imagine a provider that is receiving fair, accurate, complete, and timely payment, risk adjustment payment for the practice, they're gonna flourish. Definitely, if they are serving an underserved community, then they are capturing the risk correctly, they are submitting the data, they are working with their plan, everything is just aligned. They will flourish, the community that they are taking care of will flourish. This is one of the solutions to health disparities. And that is one thing that really drives me, because that has been the area that drove me into healthcare, especially in this side of healthcare. And I see this work as one of the solutions to health equity, and I'm very excited about the impact this will have.
Absolutely right. I mean, we talked about that risk adjustment factor that has to be accurately collected for the patient's diagnoses, right? And if it is, then people will get, for the work they've done, the doctors will get compensated fairly and accordingly, right? As we know, in underserved populations, high prevalence of hypertension, diabetes, kidney disease. And so you have to code correctly, to get compensated for all the work that we do. So I love that aspect of it. But no, Prince, go ahead. Sorry.
If you don't mind, like, one thing I'm seeing, especially when people talk about most of the resources and talk I have heard focus on the coding. You can code correctly. Everything is correctly coded, captured correctly, but you don't get paid. And I say that you don't get paid on what you code. You get paid on what gets to CMS.
Yeah.
Right. So understanding you capture it correctly and submit it correctly, timely, everything, the CMS has it, that is what you get paid on. And then that comes to the plan and back to you. Coding is necessary, but it's just part of it. You want to get to the end and back to you. So I always want to add, you don't get paid on what you get coded for. You get paid on what was submitted, what was accepted, what was filtered, and what gets back to you from a risk adjustment, Medicare Advantage risk adjustment perspective.
Love it. Yeah. So, well, look, this has been a great conversation. I think it was timely, insightful, as a lot of providers are struggling right now due to what happened with the recent hack and just understanding their billing more effectively. Since you're already down there figuring this out, this is a perfect time to just clean house and really understand it, and go check out the RAS GPT. We'll have a link below in the description to go give it a try and see what you think. But also, Prince, where will you be speaking at, and where can they find you to get more information?
I will be at the RISE Conference Risk Adjustment Forum next week. I'll be part of a panel that will be talking about risk adjustment basics, back to basics. So we'll be discussing a lot about risk adjustment basics, and people that are learning or trying to learn or get themselves together on risk adjustment. Definitely, you can see me in the Risk Adjustment Forum conference in New Orleans next week. My presentation is on the Tuesday. Otherwise, the HEALS Academy is a good place that you will find all our resources. Our YouTube channel is at the HEALS Academy. We are the only HEALS Academy on YouTube. So if you search on YouTube, we are going to come out. And our website is www.thehealsacademy.com. You can also find me on LinkedIn. I always love to connect. I always love to talk to people who are excited about healthcare, about health equity, about social determinants of health, about risk adjustment, about informatics. So that is my area, my place. And we always, LinkedIn, YouTube, and our website are always the place to find us. The Risk Adjustment Success GPT will be RAS GPT, RAS GPT.ai, www.rasgpt.ai. And we are very excited. You will be able to try and test it out. And then we are excited to always hear from you. So, our email is info@thehillsacademy.com, info@thehillsacademy.com. So you can also reach us there as well. Thank you.
Awesome. No, thank you, Prince. So everyone, listen to what he says. Go learn more about coding more specifically. Like he said, it's not what you submit, it's what gets in the hands of CMS. So you have to go check out these tools today. So go check it out. Looking for more information in the show notes below. Thank you for your time, Prince. Have a good one.
Thank you so much, Theo. All right. Thank you. Bye.